Hello, Dr. Evangelos Milonas at Kinetic Health. Now we'll be demonstrating some myofascial release exercises with the ball for the external hip rotators, also known as the deep six muscles. In anatomy often we'll use our hand to represent those muscles. And so starting out, most people are familiar with one of these muscles known as the piriformis muscle. And that's a muscle that's often involved in sciatic-like syndrome or piriformis syndrome. But a lot of people aren't aware of the other 5 muscles. So to name them, the first would be the piriformis, which is represented in my thumb here. Then you've got the superior gemellus. Below that is the obturator internus, followed by the inferior gemellus. We've got the obturator externus, and if I had a 6th finger, that would be the quadratus femoris muscle. Now these muscles are called the deep 6 muscles because they are deep to the gluteus muscles. And so often, as that sciatic nerve courses down through the gluteal muscles, in some people it'll go under, over, or through certain structures within that deep 6. And any adhesions or restrictions or compression that occurs there can create sciatic restrictions. Now, as external hip rotators, we also have to think of the antagonists. So these muscles being on the outside kind of medial part of the hip here are the agonists or antagonists, depending on how you look at it, to the muscles on the inside, the inner thigh muscles, your adductor muscles, and some of the deep pelvic muscles. So any restrictions on the inside can affect the external rotators by making them weak and inhibiting their function. And vice versa, if we have restrictions on the hip rotator side, which affect the sciatic nerve in some cases, you'll also get an effect on the inside. So a lot of the times, hip complaints, different issues that come into the clinic that we'll see often involve this agonist-antagonist relationship between structures on the front and structures on the back. So I'm actually going to tape these muscles on Mickey here. She's going to help us out so you can get a visual idea of exactly where these muscles are. Now that we've used the tape here to demonstrate on Mickey where the deep 6 muscles are, remember that this is not anatomically exact, but we're trying to give you an idea of where these muscles are located and the area that you'll be focusing on when performing these exercises with the ball to release these muscles. So as you can see, they are in a small area, roughly between the sacrum, which is the bone here in the middle, to the greater trochanter, the side of the leg. And you can see that they're layered one on top of the other. And so once again, we've got the piriformis, the superior gemellus, the obturator internus, the inferior gemellus, then we've got the obturator externus, and kind of on the edge here, like a little square right by the trochanter, you've got your quadratus femoris. So this is the area that you'll be concentrating on when working with the ball.
Dr. Brian Abels from Kinetic Health. I'm going to go over a myofascial release of the deep 6. We're going to be using a combination of a couple balls here, a soft squishy ball to basically get in there without feeling too much pain, and we're going to be working fairly close to the sacrum here. It's going to be a lot more intense, but it really helps to open up and create some shear force with some lacrosse balls. Okay, Mickey, why don't we get in there and start warming up with the black ball here. Good. So she's just basically placing it right on the structures that Evangelos was showing you previously with the tape there, and you're going to roll just back and forth across there. How's that feeling on there?
That's not too bad.
That's pretty easy?
Yeah.
Pretty easy on there? Good, good. So we probably want to do this for about 30 seconds to a minute, let's say, until we get warmed up a bit and we start getting the tissue a little more malleable. The tissue itself is innervated with fascial connective tissue, and of course this is fairly strong, and we want to make sure as we're working this over that we're actually taking the fluid that's inside the muscles, compressing it to push it out, and then releasing it a little bit so it goes back in. This way we get rid of waste byproducts, get more oxygen and nutrients into the general area. How's that feeling?
That's definitely some tender areas.
Yeah. Okay, why don't you give me the ball there, and I'll give you the lacrosse ball. Now, what we're going to do is we're going to actually use 2 of them. They're going to place it directly underneath the pelvis there, next to the sacrum. Good. And on this action, what we're going to do is actually have Mickey take her legs apart and put them back together again. Okay, why don't you describe exactly what you're feeling there?
Lots of pain.
Pretty intense, isn't it?
Mm-hmm.
Okay, but you notice it's actually creating quite a shearing force across the deep 6?
Yeah, you can definitely feel, even if you're not moving around, you can still feel a lengthening and a shortening of being piriformis.
Right. And this is something you would not experience if you're using just the foam roller.
No.
There. No, it's very intense. And you can move the position of the balls up and down just slightly to create a bit of a stress on there. Okay. And you go back and forth with this several times. Okay, why don't you do the balls there? After you finish working on this particular area, we're actually going to go back and start using the ball to create a shear force again, but kind of up and down. And this time we're going to be more on the side here. Good. And right up and down. How's that feeling?
That's good. It's a lot looser now.
Okay. It doesn't take long with a little bit of compression on there to actually get the tissue to start to let go. And again, you're going to get on the area, you're going to feel the area where the restriction is. And one thing we're going to do here is actually we're going to work in a half circle. So the bone on the side of the greater trochanter, we actually want to move around that area back and forth in kind of a half semicircle there. Yeah. Starting to feel that on there?
Yeah,
Okay.
especially around the top.
Right. Whichever structure is tighter on you, you're going to feel a lot more. Good, good.